Exercises following your total hip replacement are an important part of your ongoing recovery. The following video demonstrates the recommended exercises we teach here at North Bristol NHS Trust. These exercises are to be completed standing at a stable surface, for example a kitchen worktop or sturdy table. Ensure you maintain a good posture throughout. Aim to complete each exercise 10 times and repeat 4 to 5 times per day. Gently bend your operated hip up in front of you and slowly lower down, ensuring that you do not bend more than 90 degrees at the hip. This exercise will help to strengthen the muscles at the front of your hip and regain stability around your pelvis. Keeping your operated leg straight, move it behind you, ensuring you maintain an upright posture. This is only a small movement and will help to strengthen the muscles around your bottom and improve your walking pattern. Move your operated leg out to the side and back again. Ensure your toes continue to face forward by leading with your heel. This exercise will help maintain strength and stability around your pelvis. Lift your heel towards your bottom and slowly down again. Aim to keep your thighs level and maintain an upright posture. This will help to strengthen muscles at the back of your thigh and stretch the muscles at the front. Stand with your feet hip-width apart. Slowly bend and straighten your knees, moving your bottom out behind you. Please ensure you do not bend more than 90 degrees at the hip. This exercise will help to strengthen the muscles around your bottom and thighs. Raise up onto your toes and gently down again to rest with your feet flat on the floor. This will strengthen your calf muscles. All exercises should be reasonably pain-free. Please remember, it is normal to feel an ache after exercises.